I am so very excited to talk with my two guests today about their personal and professional caregiving and about one of my newest favorite concepts, empowered health. Allison Remelier has nearly 10 years experience in public health research and overseeing strategic initiatives and programs in the public and nonprofit sectors. Allison is currently a prize designer at XPRIZE, a nonprofit organization that designs and facilitates incentivized competitions to develop technology and innovation for the benefits of humanity. Allison is a volunteer advocate for the Ovarian Cancer Research Alliance and a CDC Foundation Empowered Health ambassador. She became a passionate advocate for patient caregiver empowerment after her mom was diagnosed with ovarian cancer. My next guest, Angela Dunbar, is the campaign director for the CDC Foundation's Empowered Health program, a cancer-related communications campaign that receives technical support from the CDC and its Division of Cancer Prevention and Control. She's responsible for leading the research, development, implementation, and marketing for the program and its digital tools. Since joining the CDC Foundation in 2009, she has worked closely with the project manager and liaison for the CDC Division of Cancer Prevention. And Angela also founded stationery design company, and I think this is so cool, the Paper Cottage, which she still manages today. And Angela is a cancer survivor and married with 3 children. And as I said, I'm just thrilled to be talking to both of you. Let's jump right into it. We'll start with Allison. Can you tell me about your individual role with Empowered Health?
Sure, and really happy to be here with you today. So I've been with Empowered Health for maybe a year and a half now. I'm an ambassador representing the caregiver experience, and they have a whole panel of different ambassadors that represent a range of experiences with the cancer journey. And I help bring some of the perspective from what my family went through to some of their work. I've been able to be part of really interesting conversations and weigh in on some of the important initiatives that they're advancing related to empowered health.
Allison, during your mom's cancer, what did you see as your role, and how did that role evolve over time?
Yeah, so my mom was diagnosed with ovarian cancer about four or 5 years ago. When she was initially diagnosed, it was stage 1. There was a lot of optimism that it could be effectively treated. Her specific subtype was really responsive to the chemotherapeutic drugs that exist. So initially, it was sort of my role was just being a support. You know, when my mom was going through challenging chemotherapy treatments, I was around. I was actually living at home at the time, doing my graduate degree. And so it was really, I felt really grateful that I was able to be around for her in that way. You know, she was like a lot of patients are, she was an extremely motivated fighter. She would, like, after a chemotherapy treatment, go out for like a 2-mile walk because she just didn't want to let it slow her down. As often happens with ovarian cancer, there's high rates of recurrence. And so ultimately, that's what my family went through, which is an experience that a lot of families have. You know, we moved through several lines of treatment as her cancer came back, which was really challenging. And at some point, you know, we ran out of standard therapies, and we sort of, I kind of describe it as like falling off a cliff of care. We were sort of on our own. And so at that point, we had to become empowered because they were out of options for us. And my mom's priority was to fight. And so at that point, I had a lot of training in public health, which was lucky, and the ability to quickly understand literature and speak the language of healthcare providers. And so my role sort of shifted from being one of general support to being someone that was actively trying to develop treatment pathways for my mom. And so we learned so much, and you know, about navigating the clinical trial system, about different healthcare systems, cancer care centers, biomarkers, genetic testing. I mean, it was like incredible the amount that we learned, and we came at it from a lot of advantage because of my education. My family lived where we live in Los Angeles. We had a lot of access, and so we sort of had a leg up. And it was hard enough. Like, it was despite all of those advantages, it was something that was extremely challenging. And sort of my role evolved to become, as it often does with the parent-child, you know, as you move through life, your roles of responsibility sort of start to flip as maybe the parent gets older. I sort of experienced an accelerated version of that. And then finally, you know, we had some success for a while with targeted therapies. But eventually her cancer was so aggressive, we, you know, unfortunately lost her. And so at then, you know, my role, and I was least well equipped for this, was sort of the grieving part together, facing that together. It was really hard, but, you know, definitely went through an evolution of, I think this isn't talked about all the time, although everyone experiences it, but just the perception of myself changed, my family unit changed a lot. In some ways there were really hard days and really empowering days. And reflecting back, you know, that's the lesson that I'm carrying forward. But yeah, I mean, it was an extremely difficult but and sort of incredible thing for my family, and we sort of forged an incredible partnership together.
Yeah, there's so many pieces of that that's so important for family caregivers. One is we do become the CEOs of Caring for Our Loved One Inc. through the metaphorical phone call in the middle of the night. Tessa's come back, mom's wandering, there's been an accident, and now you walk through this looking glass of people yelling acronyms at you and asking your opinion about things you never even thought of before. And you take on that role, and you took on that role of being empowered, of being fearless, of being the CEO, but also the idea of what happens next. That's a big issue. How does it change the family dynamics? How does it change you? And I've seen so many people come out of, you know, the grief and become stronger and more empowered, and even take on new roles in the community. So thank you for this conversation. I appreciate it.
Thank you.
Angela, so what was your experience with caregivers, and what was your expectation?
Yeah, so I'm the opposite, right? I think of you, Gary, and Allison, because y'all were both such amazing caregivers to your family. So I was on the other side. I was fortunate to be surrounded by caregivers. I was diagnosed with breast cancer, went through treatment, went through double mastectomy, reconstruction. And so I guess when you ask me what my experience was, I was used to being the caregiver, right? Especially like as the mom and the wife, you just take care of everyone. And so it was a little hard for me to make that switch and to accept care from my husband and, you know, from my mom and dad, you know, who came into town to care for me, from my friends. I was the one who organized the meal trains. I was the one who dropped off flowers. And so it just took me a minute to find, to be humble, to accept the help. But I got there with candid help from my husband and others. But it was an amazing experience. It filled me with such, you know, I don't know, just grace and love that, you know, to see people from all walks of my life who showed up in a variety of ways to offer support and empowerment and physical care. I had 2 teenage boys. One was in college, one was in high school. I've got a little girl who's 9 years old now. And so to see how they each chose to be a caregiver to me was a beautiful thing.
That's a really great point. And I'm so glad you brought up the fact of the role that the care recipient plays in so many cases. It's empowering, there's the word again, for you to be part of it, as opposed to just feel like, well, now everyone's going to do for me, because it's a partnership. In that case, it becomes a partnership. But the other thing I like that you mentioned is then you learn to step back and be cared for and be humble. Another great word. So this gets me thinking of those immediate barriers, and I'll stay with you, Angela. What barriers did you find to this care, and how did you overcome them?
Sure, that's a great question. I had some different barriers just because I went through my treatment and surgery during COVID. So I wasn't able to have my husband attend my appointments, or even, he wasn't able to go in, be in the hospital when I had my surgery, or join me in treatment. So that was a barrier. But I relied on my faith. And I just prepared. My husband was really good at helping me prepare for my appointments the day before. I remember he would say, "Do you have your questions written down? Okay. Are you still unsure about this? Do you want to talk about this option or this option?" So that was really helpful for him, just to help me prepare. And I remember at one of my first appointments, I went without him. I had my purse and I had my notes right there with my questions. And I walked out, and it's so overwhelming. And when you don't have that caregiver in the room with you who is laser focused on you.
Yeah.
And I didn't pull the notes out of my purse. I just got overwhelmed. And so I later had to call back. I later had to schedule an appointment, and that was a good lesson for me. So I would walk and have the notes in my hand. So that was a barrier. And I think also, as I mentioned before, I think there was the barrier of not wanting to be a caregiver, not wanting to be cared for, because I was always the caregiver to other people.
Right.
And then there's some grief associated, even in someone who has a successful cancer experience. There's some grief associated with, physical changes in you, mental changes in you. So that was a barrier. Just, dealing with the changes in my physical appearance, my mental health. But I think you asked how I got over this. And I think, ironically, I was the campaign director of EmPOWERed Health. So it was one of those where you just have to lean into what you know, and it was right there in front of me. So I leaned into the resources of EmPOWERed Health. I leaned into the benefits of accepting care from your loved ones, and in making decisions, empowered decisions together. And that was key for me, is that I felt as though I wasn't being told what to do in the end. I felt like I had a say in what was going to happen with me.
That's terrific. That's so great. You used the training that you supported other caregivers, care recipients with, for yourself, which is pretty cool.
Yeah, I have this one quick story that I've told before, but I think it could help people. Was I had gone to an appointment, my husband wasn't there, and we were deciding on some surgery decisions that needed to be made. And there was a detail in my surgery that I just wasn't happy about, but I didn't voice that. And as I'm driving home, I'm just like really upset, and I'm on the phone, I'm talking to my husband, and he reminds me of my work with EmPOWERed Health. And he was like, "Well, did you ask? Why do you have to do that? And why can't you do that? What are the risks and benefits of doing that? And what are the risks and benefits of doing nothing at all?" And I knew all this, but in the moment, I just forgot it. So again, I was able to have a secondary conversation, and I was able to, put the EmPOWERed Health kind of mantra into action for me. And it made a big difference.
I think that's really great. That's really important, especially since you were able to work with your husband. He was able to remind you of your own training, and that kicked into action. So that's pretty cool. So Allison, what were some of your barriers, and how did you break through them?
Yeah, I think similar to Angela's experience, I think some of my barriers were definitely around like agency, and realizing I had agency and feeling empowered in the doctor's office. Like, you get in that situation and there's sort of that power differential, and you sort of, things that leave your mind, even if you come from a place of knowing that it's okay to ask questions, it's okay to have input. I didn't really, I think overcoming that barrier took us being in such an extreme situation, which was that our doctors were like, "We have nothing else for you." I wish it hadn't taken that you know, for me. I wish earlier on I had known to ask about, okay, well, if we, you know, she has that treatment, will that preclude us from accessing this other treatment down the line? You know, like having a framework for those questions. Like I wish I'd known to start from baseline and have that empowerment and have that agency, but it's really hard in that context. So, I mean, that was definitely a major barrier. And I think another one is just sort of how siloed our healthcare system is, especially as if you move off of like standard treatments into more experimental therapies, like you're looking for trials in different cancer care centers. None of your information is necessarily that portable from one treatment healthcare center to another. And so my dad, actually, he and I sort of did a lot of tag teaming, right? We brought different things to the table as caregivers. We each did caregiving in our own way, sort of like Angela mentioned with her kids. Everyone kind of has their own strengths.
Yes.
And so my mom had a really specific biomarker for her cancer that he started tracking over time, and we'd integrate the values from different cancer centers, and we had a huge picture of it over time. And so when we'd go to a new place, we'd be like, you need to pay attention to this blood biomarker. And people would be like, oh, okay, we guess, because it was so specific. If you didn't know, you didn't know to look for it. And then it would show her response to treatment, and they'd be like, wow, I guess it's real, you know. And it took us, you know, advocating for ourselves and coming prepared, which wasn't easy to know how to do intuitively, but information is power. And I think it's nice to see more and more movements for people to have better access to their information. You know, now you can see, it's a requirement that you can see your doctor's notes in your medical record. I think there's better sharing of medical records. You don't have to just like request it and have them fax it. You know, it's like, I think, you know, combining the patient and their families' devotion to the cause, which is like, no one's going to care as much about my mom as I would do. No doctor, however dedicated they are, but combining what the family brings, their own expertise, their knowledge of the patient's history, the incredible commitment they have, with what the doctor and the care team bring, it's like really, really powerful. And the shared treatment decision-making thing is something I'm just so passionate about. And there are a lot of barriers to it as they currently exist. So I'm really excited, like places like Empowered Health are educating and promoting that message more widely.
There was something that Allison said as a barrier when, Allison, you said at the very beginning about that differential role between a patient and a provider. And it made me think of some advice I got from a mutual friend of ours, Allison. I was really being intimidated from my providers because, you know, you go in and you sit on the table, and sometimes you're in the gown and your feet are dangling off the table and you feel like a little girl. And then here they come with their white coats and their clipboard and the entourage of, you know, their team behind them. And I was sharing this, like it made me feel like a little girl and just insecure. And I had a friend of ours who said, well, don't sit on the table, Angela. Sit in the chair with your feet on the ground and see if that helps. And that little change just made all the difference into the world to me. It just, I don't know, it just changed my attitude. It changed my feelings of empowerment. And it was just a little tweak that really made a big difference for me.
And these are the kind of tips we get from family caregivers at our Fearless Caregiver Conference. There's something on our YouTube channel that shows a caregiver talking about bringing a small portable tape recorder. You know, and I've done these events all over the country. And when I've had a physician on the panel, they go, yeah, do it. If your doctor doesn't let you, it might be time to find a new doctor. You know, just because we're not going to remember, we're not going to pull out that notepad all the time. We'll drive away going, what was it that she said? So it's nice to have that kind of empowerment. There's the word again.
Mm-hmm. You're right.
That kind of strength. Let me ask both of you this, and I'll start with Allison. What is the most important piece of advice you'd like to share with family caregivers, with the loved one in crisis?
No, it's a really good question. I think it's something that was really hard. I think for my family, I think we tended to try to just do the everything is fine approach all the time. And I think we had some really unacknowledged like distress and trauma that was happening that that I didn't get to address until after my mom, passed away. I think in those moments I didn't always know how to be there for her, because I was scared like I would uncork like everything that she was holding in. And I really wish that I had given her permission to talk more about how it was affecting her emotionally. I think if I'd given her that space, maybe it would have really helped her and helped me a lot. So I just think having like really honest conversations is something that I wish I'd known from my own experience, from like sort of the crisis or distress part. I think there's so many things that caregivers have to juggle as part of their role, right? It's like medical appointments, but also practical matters. You have family, you have kids, you have, a lot to juggle. And I think it can be really hard to ask for help. It sounds like, like Angela had a network of folks and that like came in and offered, but I think it can be hard for people to know what to offer you. So I think having a list of things ready that you can hand off, like if someone's like, I'm here to help, I don't know how to help you, just knowing the things you can start to delegate, which can be really hard for people to do. I think it helps that two-way support. It's like it can be hard for you to just go to people and ask for help. It can be hard for them to know how to help you. I wish I'd done a lot more of that myself, because it can feel really isolating, cancer, and I don't think it has to be that way.
That's really great. And I'm sure that's something Empowered Health is helping train people to have that list in their back pocket. Oh, you want to help? Here's something, bite-sized, easy, manageable task you can do for me. Because I've never seen a situation where a caregiver asks for something viable that someone else can do, that other person isn't going, oh, thank you, because I didn't know how to ask you what I could do to help. And the other part is, and it's tough. I went through this with my dad, and I did have these conversations, but I was hesitant at first, and he was thrilled to be able to open up, talk about his childhood when he was going through cancer. And that's a barrier we need to overcome, to be able to say to our loved one, tell me how you're feeling, talk to me, let's share this moment, instead of going, well, everything's fine, look here, look at the balloons over in the corner. So thank you for that. Your turn.
No, I agree 100% with Allison. I remember specifically, it wasn't long after one of my last surgeries, and my oldest son came home from college to check on me, and I had such pressure to just be on, to just act like there was nothing wrong with me. Like, and my husband, they were going to take the dog to the dog park, and they were going to get my little girl out of the house. And I was like, oh, I want to go. I want to go. And, I am so proud of my husband that he pulled me aside, and he said, it's okay, Angela, it's okay. We don't expect you to be 100%. We want you to get better. We want you. So rest, relax, let me do this for you. And I needed that permission for him to say it was okay. And so I think that was really important to me. And I think, as I mentioned earlier, just being able to know what's on the table for you, and then to be able to talk to your caregiver and your healthcare team, because in the Empowered Health module, all of those people are on your team. So, the patient, their caregivers, their loved ones, and of course your providers. And I think it's real important to talk about all of the options on the table, and let's weigh the pros and the cons and come up with something together. Where I think back, like, maybe when my parents were younger, it was you were told what to do, and whether or not that just is how it happened because of culture or society. But I think hopefully we're moving in a very different and positive trend where patients have a definite role in their healthcare choices.
Well, I think
breathe, right? I say breathe. That I always had to remind myself to
breathe.
Breathe.
I think what you're doing, CDC's doing, what you're doing as an ambassador for Empowered Health is going to be this help, this support that caregivers and patients need, even in the partnership between caregivers and patients. So thank you for your time. Thank you for all you do. And thank you for spending a few minutes with me.
Well, Thank you so much, Gary. And just if anyone is interested in the resources, you can find them at empoweredhealth.org. There's something I think for everyone, short videos, fact sheets, audio podcasts, and it's for patients, caregivers, providers. There's a prevention aspect. So I hope it could be helpful and beneficial to someone. Thank you for having us, Gary.